Good afternoon and welcome to the Tuesday Times Roundtable, where each week we engage in conversation around current global issues, trends, problems, and opportunities that are of interest to you. Our weekly Tuesday Times Roundtable is made possible through a formal partnership with the New York Times. This partnership provides you guys, FIU faculty, students, and staff with free digital access to the New York Times newspaper. I'm Sherry Beeson, one of your hosts, as are Anna Prado here in the back and Michelle Zaldivar, who is monitoring this session live on Zoom. We work together in the Office of Global Learning Initiatives here at FIU. Now Michelle has a special announcement for you all.
I should have checked this for a sound check before, but we're good. So particularly for this TTR, we wanted to make sure to highlight an Office of Global Learning Initiatives club that we sponsor, which is GlobeMed. GlobeMed's vision is to pursue health equity worldwide. So if this is something that interests you, if this Change the World checklist speaks to everything that you believe in, which is why you're here for this talk on health equity and research, please take a minute, go ahead and scan that QR code. We are currently in a rebuilding year, looking for board members, e-board members to fill roles in events, marketing, fundraising, social media. So if you're interested in taking a leadership position in FIU in this research equity community, take a moment and do that, and we would appreciate it, and we'll hear from you.
Awesome. Thank you, Michelle. And a quick reminder to our Global Learning Medallion students that this event counts as 1 point. If you'd like to know more about the Global Learning Medallion program, Peace Corps Prep, or our Global Learning programming in general, please stick around after this event and talk with Michelle, Anna, or me. So whether you're joining us face-to-face here in GC 150 or live via Zoom, we are glad you're here. Later during the session, we will be taking your questions. So if you're joining us virtually, please post your questions in the chat and Michelle will share them with us. Otherwise, Anna and I will be walking around with a mic to make sure your questions are addressed. Before I introduce today's speakers, we would like to give a special shout out to Vida Talab, a Global Learning Medallion alumna who made our connection with the All of Us program possible. So if you are a Global Learning Medallion student, just think of the possibilities for you to come back here and contribute in this space in the future. Don't forget us. Now it is my pleasure to introduce today's speakers. Claudia Figueroa is a graduate student in the Robert Stemple College of Public Health and Social Work. She is pursuing a master's degree in public health with a concentration in maternal and child health. As a student engagement ambassador for the All of Us program, she has enjoyed teaching and engaging with the FIU community. Through speech and communication, she makes connections with others and hopes to impact them in a positive way. In the future, she plans to pursue a career in medicine that will incorporate all she has learned in public health and through the All of Us research program to become an excellent medical professional for the community. Nandy Smith, directly to my left, is also a public health graduate student in the Stemple College of Public Health. Her academic concentration is in health promotion, disease prevention in the minority population. She is a new student engagement ambassador for the All of Us research program, and we're super glad that both of you are here. Take it away, Nandy and Claudia.
Thank you so much. Welcome, everyone. Welcome, everyone in person, everybody online. Again, my name is Claudia. I am a student engagement ambassador for the All of Us research program.
Good afternoon. Thank you so much for being here in person and also in Zoom. As Claudia mentioned, we're so excited to be here. My name is Nandy Smith, and I'm also a graduate student.
And today we'll be presenting for all of you guys, Fostering Trust in Health Research.
Okay, awesome. Thank you again, Claudia. So I'm not sure if you guys got a chance to actually read the article, What Barbershop Can Teach about delivering healthcare. Now, this article talks about intervention that took place inside of a barbershop. Now, a lot of people might not know this, but the barbershop is very significant, especially in the African American community. It is part of our culture. It is a place where a lot of people not just go and get haircuts. It's a place where you come and you talk about your personal life. It's a place where it feels like family. And also the barbers that's in our community, they're very well respected and they're very well trusted in the community. So it only made sense for them to do this intervention inside the barbershop where it's already trusted. During the research experiment, barbers were trained to check blood pressure for their clients. Results showed an increase of patient retention and lower blood pressure levels due to barbers engaging in lifestyles and modification. And I could tell you that this actually is something that has worked. As part of the NAACP, we actually did a health fair. Yeah, we actually did a health fair, and we invited the community. And I really didn't know what the outcome was going to be, but I know that we've been in the community. They trust us, and I could tell you the outcome was overwhelming. We actually had to stay overtime because there were so many people that actually showed up, and we did blood pressure. And you'll be surprised how there's some people who haven't even checked blood pressure for years, but they came to our event, and we were able to say the same way as this intervention, we were able to help them with their lifestyle and saying just something as simple, this is how you read your blood pressure level, and we had a great turnout. So I could tell you that building trust is definitely a very important key part into any relationship, especially in the health field. So if you could take a look into our chart, right? Studies show individuals who are part of the racial and ethnic minority don't trust their doctors or the medical community. So if you take a look, Black and Hispanic usually tend to not trust their doctors, less than white, especially lower level, less education, and uninsured individuals, And 59% of Black don't trust their doctors. 72% of Hispanic don't trust their doctors. If you look at the local hospitals, 56% of Black don't trust their local hospitals, and 62% of Hispanic don't trust their local hospital. And if you come down and you'll see where the healthcare system, 44%, which is a very, very low number, 44% don't trust their healthcare system, and only 50% of Hispanic don't trust their healthcare system. So what exactly does that tell you, right? For an individual, if you don't trust your doctor, you cannot trust the hospitals, and you can't even trust your local health system, that individual is less likely to seek medical advice, treatment, or preventative care, because those are the combination that actually someone need to trust and to, tell you about their personal life. So if I can't trust you, then there's no communication. And trust is a very important factor for the patient and doctor relationship. So obviously, based on this chart, there's definitely something missing there. And then in public health, we hear the word health disparity a lot, right? But I wanted to actually define what exactly is health disparity. We say it all the time, but what exactly is health disparity, right? So I just wanted to read the definition of what health disparity is, right? Health disparity is defined as a difference in which disadvantaged social group, such as the poor, racial, ethnic, minority, women, and other groups who have constantly experienced social disadvantage or discrimination systematically experience worse health or greater risk more than a advantaged group. So after reading the health disparity, the word that kind of stood out is the constantly, right? If you're an individual and you're constantly struggling, trying to get access to health insurance, you're constantly trying to get service, what that actually does is it you're not going to trust the health system. And as if you could see in our chart here, black and Hispanic who are uninsured, tends to have a very low rate and have a high rate of asthma, diabetes, hypertension. So they have all this, especially chronic disease. So they have all this thing going on, but at the same time, you're having such an issue of trying to get insurance. So that right there goes back to what I was saying before with the lack of trust in the healthcare system because of those barriers, right? So this is not a new topic, right, of distrust, especially in the minority community. This is something that it's been talked about for years. It's been it's been going on, right, for years. And so distrust in medicine and research has been a constant historical theme as minority individuals have been targeted and related to ethical controversies. So these are 3 examples here. Of course, there are hundreds, but these are probably the 3 popular examples that a lot of people have probably talked about. Dr. J. Marin Sims, he did a experimental surgery on enslaved black women without their consent, and he didn't even give them anesthesia. So just imagine, right? You're having surgery with no anesthesia. The pain of that, you actually won't ever trust that doctor or any other doctors just because of just the lack of being violated, really. And then you have the Tuskegee syphilis trial where researchers did a research experiment on 600 black men in Alabama without their consent, and then also didn't give them any treatment. So just imagine, how they would feel. And then you have Miss Henrietta Lacks, right? A doctor from Johns Hopkins back in 1951, a doctor from Johns Hopkins Hospital used her cancer cell to do research without her consent, and she had no idea, and her cells are still being used around the world to this day. So, again, and I have a very personal story with Henrietta Lack. During my undergrad, I actually had a theater class, and I had to we performed her life. I had no idea anything about Henrietta Lacks. And so, to our surprise, her family was in the room. And I could tell you, it gave me chills because I just couldn't believe that her family actually was there. But I could tell you that they were still affected by it. They were in tears. And this is something that happened years ago. And they were in tears in the audience. And they were thanking us for, demonstrating her life and actually honoring her life, really. But I thought about while I was doing this presentation, how much it affected them, generational, in their family, right? To have someone so close to you and that happen. My goodness, I can't imagine how I would ever be able to trust a doctor or research because it's in your family and firsthand of, oh, yeah, so no, this is not going to work for us, right? And so these are a lot of histories where we see that, especially my African Americans don't trust the system, can't trust their doctors, can't trust their local hospitals, but it's for a reason, right? It's not something that's just in vain. So I'm kind of wondering if anyone is welcome to share any stories that they may have that may cause you to have any distrust in the system, in the with our doctors, researchers. Feel free to go ahead and share online. Don't hesitate to just let us know. Yes, Ms. Garrett. Okay, awesome.
So they won't hear you. Okay, sure, you'll take it.
Thank you, Nandy. Thank you, Claudia. I happen to be faculty in Stemple College of Public Health and Social Work. Nandy's one of my students, so I just wanted to see how she's doing. So recently, I had an injury with my foot where a nerve was cut, and I had to see a neurologist. And before the neurologist came into the room, a medical resident was there, and I'm all for students learning and didn't mind sharing the history and what happened with my foot and sharing my symptoms with what was going on. But this person said, oh, it's all in your head. And when the neurologist came and read the notes, she was livid that he would say something like that to me, the patient, that if I'm experiencing pain in my foot, how is that in my head when my nerve was cut? So that person really needs bedside manner training, really needs to know about cultural competence and humility.
Yeah.
So, and I just recently experienced that. So we still have a lot of work in terms of trust, because I have a great level of education and know better, but other people, after that experience, may say, I'm not going back. And then therefore they may not get the health care that they need.
Right, and I'm so sorry you had to go through that. But unfortunately, there's a lot of people in our community who goes through this silently all the time, you know. Anybody else would like to share? Yes.
So, big contemporary issue. My family was directly affected by overdiagnosing of opioids and OxyContin, and that was really it broke down so much of the trust within my family and extended family, and it was my grandmother that was directly affected, and it's definitely made its way through the generations. And again, right, at a certain point, I know better. I can support my family as much as I can, but there are so many of them already that don't want to listen to doctors or think that they're manipulating the systems, and it's a far reach even beyond the one person in my family that was directly affected by actually taking the medication. The fallout of that is widespread.
Absolutely. Again, so sorry that your family had to go through that. And
This is actually really recent. I don't know. I think the microphone's off. Maybe? Okay.
yes.
So this is actually extremely recent, but over the past 2 years, I just knew something was wrong. Felt something was wrong, felt like something was wrong, and I went to multiple doctors, and they were like, "Oh, you're young, you're tired, you know, it's okay. You'll feel fine, whatever." And I finally, it just happened 2 weeks ago, I finally got an extreme diagnosis, but it took going to 3 different doctors and actually giving up for like a good 6 to 7 months, just being like, okay, nothing's wrong with me, because I did get told it was in my head. I was recently diagnosed with lupus and fibromyalgia. It's not in my head. There's actual real symptoms. But I constantly, oh, you're just young, you're just tired, you know, go to sleep, get it your 8 hours. So it takes a lot, and it took 3 doctors for someone to finally truly listen to me and hear me out. And I was at this point, before I came to this doctor a few weeks ago, I was ready to give up. I was like, okay, after this, I am done. If they tell me nothing's wrong, I quit. I am giving up. And I know that happens to probably a lot of other people, and it's really, really sad. Yeah, that's it.
So much for sharing.
Yeah, and sorry you had to go through that, unfortunately. Yeah.
I guess I could also go in with a general consensus. I am Hispanic myself. I identify with the Hispanic community. And one of the general sentiments that my family goes through every time there's like a need for a change of a doctor or a family doctor is that hesitancy, whether or not the doctor will listen to them, to listen to their complaints or listen to what their medical histories are. For example, my family, hypertension runs through it a lot through my maternal side. So they're very, very cautious of who they will give their medical histories to. And that hesitancy also falls in with a lack of trust that there is in the medical system here currently. So I can take it from here, Nandy. Thank you so much. I want to bring back the article again. One of the most important things that the article left us with was that their results were successful when seeing how many clients were able to willingly share their medical histories and their personal information to these barbers. And these barbers in the study, and to me, represented the community and how the community was so important in their lives, as Nandy had mentioned earlier. And one of the main vocabulary that appealed to me was unconventional. This study was an unconventional way of delivering healthcare to these community members. And unconventional also relates to untraditional. So the takeaway from the article meant that locating intervention in the barbershop meant introducing a new way and a new method of delivering healthcare, something that it's not currently taking place. And with innovation and change, that is something that now research and science is striving for in order to break down those barriers of health disparities, of distrust and trust in the medical system, in order to provide optimum care for many individuals and members of our community as well. So here's where we come in and where the All of Us research program comes in. So the All of Us research program is an innovative new research program that wants to improve research in an untraditional way. It focuses on its participants as members, as individuals, where they want to target their biological factors, which revolve around their genetics, family history, as well as their lifestyle factors, how they go about their daily lives, their daily routine, and also their environment, where these individuals come from, their location, where they live, what are their customs and traditions around in their environment. And this is a way to make ends meet through generating a large health database in order to answer many questions in research now. And also, at the same time, it's building trusted relationships between the participants, researchers, and the community, because they're giving them an open space and a comfortable space where participants feel welcomed in this new research program. So to talk a little bit more about the All of Us research program, one of its main core pillars is diversity. It's its core value as they recruit individuals from different races, ethnicities, age groups, genders, sexualities, and religions of the country. And also, they focus on different socioeconomic statuses, education, and health statuses of the participants and volunteers that want to be part of the program. So 3 important factors that the All of Us research program focuses on are stated here in the bright yellow circles. The first one is transparency. And transparency can be defined as the type of information that participants and the All of Us research program will be exchanging. They want to make sure that participants feel safe in sharing whatever they are comfortable sharing. So they can share anything from family history, medical records, sometimes even blood samples, saliva samples as well, as the All of Us research program has a collection, specimen collection sites in order to, again, build up the database. But transparency is something that they're they hold highly of for anyone that wants to become a member. Also, inclusion. It's very inclusive, as I stated again. They want to recruit individuals of all walks of life that are represent this country. For example, the country is made up of different races, different ethnicities, different languages, different age groups. So they want to gather a database that will be representative of the community members that live in the United States. And finally, community engagement. The All of Us research program goes beyond just recruiting participants. It's also a program and a way of teaching. As we are here today, this is a form of teaching that we do from the program. And we talk about not only the biological, lifestyle, environmental factors of individuals, but we also like to talk about relevant health topics, as we did earlier, as the trust and distrust in the medical system, and health disparities as they're so prominent in today's community. So to talk a little bit more about us and who we are here at FIU, we're both student engagement ambassadors that are representing the All of Us research program here on campus. And we've been active for about a year now, a year and 2 months, I believe. And we've had active social media handles on Instagram and Twitter. And we like to talk about different health topics as well, and honing them in as conversations that are relevant for college-age students, that are relevant for the community that's here at FIU, here with all of us, you are all here with us. Play on words on purpose. But basically, where we live in Miami, we like to talk about things that are relevant to us in our city as well, and relevant to the campus. So teaching is one of the many things we do. We do presentations such as we are doing today here. We've done presentation with many other student organizations. We're trying to build a campus community with them as well, trying to engage with them and have conversations in order to expand what we're trying to do. We've done tabling events as well. Again, our social media, and most importantly, engagement. We love learning about the FIU community. We love to learn about everybody here, about the resources that are on campus, and we love to share and expand that message that FIU and all of us is trying to communicate with our students. So, sorry, can you go back for a second? We welcome everyone to follow us on social media, on Instagram and on Twitter, and you can learn a little bit more about us through there. And a little sneak peek from us. We will be hosting a series of virtual presentations throughout the fall semester. And a sneak peek of it would be, our topics will be on alcohol and genetics, as well as sleep and time management, as they are topics relevant to us as college students. And I wanted to give a special announcement for our virtual guests that we will be sharing a registration link, and through this link you can sign up, and we will be giving away at random special giveaways for them. And we welcome everyone to participate in our giveaway as well. And with this, we conclude our presentation and open the floor for a Q&A session. Thank you, everybody.
Thank you. Any questions? No?
We have, first of all, thank you so much. Absolutely wonderful work, really important work in the community that you guys are doing. I have some questions and some comments, and there's lots of action going on in the chat. So absolutely, if you're on the Zoom and you want to hone that in as a question so that I can ask it to the panelists and we can open up a discussion, that would be great. But one of the questions that we have here is, what do you think is a solution a contribution towards a solution to educate healthcare workers on trust issues, right? Should it be something that is in the coursework, is in part of entrance exams, is part of culture and community? Maybe if you can speak to some things that some institutions have done that have worked, or anything that you found in your research.
Well, I personally think the solution is exactly what the Barbershop just did, right? A lot of times I think that people, especially doctors, they think that healthcare needs to happen at the office, at the doctor's office. You know, that is something that's probably a thing in the past. It's still okay to do, but it's a thing in the past. And I think that is important for, kind of like you said, culture and community. They need to come in to the community. They need to come into the barbershop, the salons, the parks. You need to be in the community to know your audience, to know people, so that they could feel comfortable, because there is a history of distrust. So you have to kind of gain their trust. In order to do that, you have to, you have to be a familiar face for people. So if they don't know you, they can't trust you. And so I think the first thing that needs to happen is, because we already know the problem is they're not going to go, right? So you have to come to them. Mm-hmm.
I also don't want to dominate the question and answer. So if there's somebody else in the room, we can go back and forth. Yeah.
Thank you. Just want to make a comment and add to what you said, Nandy, which I think was great. I think it also helps with education and training of healthcare providers, because when you don't know, you don't know. So just like with my experience with the medical resident, he absolutely needed additional education and training on how to talk to people, how to talk to patients, how to be empathetic and understanding, and certainly wanting to maintain the dignity of your patients. So I think education and training of healthcare workers needs to be included. And that's what we try to do with our public health students.
Yeah.
You'll see that. Thank you.
Thank you.
Really great question here. Have you seen the effects of, and to what degree, is this really impacting our community, especially, of social media misinformation in the public's perception of medical institutions and fostering that mistrust, almost like solidifying that mistrust in so many ways?
I think we can give a very relevant example as the times that we live in. I could talk about vaccine hesitancy and all of the different informations that have been published through social media, through the news. You hear these things that may or may not be actually not be true at all, and you have so many members in the community listening to these things, and causing them to have that vaccine hesitancy and continue with this way of life of COVID that we live in. I think Nandy, not that long ago, she shared a story with us and her vaccine experience. I don't know if you're willing to
Yeah,
share.
it's so funny that you asked that question, because as a public health student, right, in the beginning I'm like, I should know better, but because of my culture, where I'm come from, like, my family is just the talk, and the people that's around us, you almost forget, like, okay, I'm a public health student. But I actually in the summer had fortunately got COVID, and so I was like, okay, I need to let me just get the vaccine, right? Obviously, just like I'm going back to school, let me just get the vaccine just to be safe and protect myself. And then one of the once you get, what is it called, a tracer, a COVID, the tracers who call you back just to see if you're okay. And then I asked the question, I was like, oh, do you think I should get the COVID vaccine? He said, well, I wouldn't really do it because it causes infertility. And I was like, huh? But I mean, just think about the misinformation. If I wasn't a public health student, if I wasn't connected to my professors and just, the knowledge of my peers, I mean, you would probably take that and just never get vaccinated, because it's like you're just getting information from someone you think is a healthcare professional, and again, it's just a lot of information on social media. And it goes back to what Ms. Gura said. It's really about education. At least we know where to get the right information, the sources, but a lot of people don't. So then they have to, and they don't trust doctors or any researchers. So you go to friends and family. Mm-hmm.
I think another good one along the same thread here is you guys talked about high blood pressure and hypertension and those kinds of medical exams happening in public. What other kinds of like medically advisable checks can we do safely in unconventional spaces? Like, what else can we bring into the community?
Ooh.
I mean, high blood pressure is a really important one, right? Such a grounding factor. But are there any others?
I mean, if I could think one, like, from the top of my head, especially with the climate that's going on, is mental health. I think that we can definitely create a safe space for people to talk. And I know that a lot of minorities don't believe in therapy, but with the time that's, it's such a crucial time. So we can create a space where maybe they're not going to just sit down, because we already know they're not going, right? It's like we know the problem. So it's like finding a new way, kind of like what all of us is doing. It's just finding a whole new way to reach people, right? So that they could get the help that they need, feel safe, And overall, it's just making, everyone better and safe. Mhm.
Okay, so I'm just going to read a couple of comments, and maybe if you guys want to comment on them. So someone in the chat says, I am a medical student, but also teach graduate students who are planning on medical school, as well as honors college pre-med students. We have been incorporating sessions on healthcare and bias into all of these programs. Additionally, although a bit old, and the chat moved. Additionally, but there are some excellent books that they recommend, including one called Medical Apartheid by Harriet Washington. Somebody else earlier also said a couple of other things that have been enacted in the medical community. Apparently, the MCAT in 2015 also started including some sections on sociology and psychology, realizing that these were important issues for pre-medical students to deal with. So, I mean, as graduate students, especially, I don't know if you can reflect back. What are some things that really prepared you to deal with this from your undergrad, right? Not just in your personal experiences, because you've shared of that, unless you would like to share more, but in your academic experiences.
I think in my academic experience through undergrad, my academic background is very heavy on like the life sciences, a lot of biologies and organic chemistries. And for what I want to do in the future as a professional, it really wasn't until I got here to FIU to pursue the master's in public health, where health disparities and these issues became so relevant to me, and how if you want to pursue a career as a professional in the health field, you have to be aware and conscious of the type of individuals that you'll be meeting across. And something that was so relevant to me from Ms. Greer was what she mentioned about cultural competency and humility, because at the end of the day, you're treating individuals that have beliefs, that have customs, that have their languages and religions, and you can't just treat anyone as a one-size-fits-all, as if it's the same individual over and over again. We all are different, and I think that's what makes diversity so beautiful, and the community that we relate to.
I wanted to follow up on that because I was also a pre-med student up until my junior year before I discovered public health through, funnily enough, GlobeMed. I was the GHU coordinator for GlobeMed when I was in my undergrad, and I think the best advice now that I am a public health grad student for those who are interested in going into medical school or other pre-health professions is to round out your knowledge beyond what you're taught in biology, because biology is very much the science part of it, and public health is the community population, human aspect of it. So being able to round out your knowledge with public health, with sociology, with psychology, taking those courses, being involved in extracurriculars like GlobeMed, where you're not just solely focused on health science, is some advice that I would give for those interested in wanting to broaden their knowledge.
All right. Are there any more questions in the room? We don't want to leave anybody out. Okay. Well, please join me once again in thanking Claudia and Nandy for coming today and sharing with us. It's been a great presentation. And if you are still curious about GlobeMed, there's a little more or the same information once again, so that you can access that and maybe become part of what's going on here at FIU. Thanks again, guys.
Thank you for having us.
All right.